Good afternoon, my name is Jessica. I'm a student physical therapist assistant, and I'll be working with you. Is that okay? Can you confirm your name and date of birth, please?
Fernando, 11/21/02.
Perfect. Okay, Fernanda, so it looks like today I reviewed your plan of care with the supervising PT, and we're gonna trial a TENS unit today. Have you had one of those before? Have you used that before? No? Okay. But first off, do you have any history, any cardiac problems like a pacemaker, any history of cancer? No? Okay, good. And then, so what we're gonna do with the TENS unit, there's 3 different modes that we're gonna try today. And then you're gonna tell me which one you feel better, so we can send you home with a TENS unit. Okay. So, for the first one,
So like
this is the TENS unit we'll be using. It's called Intellect unit. And then it comes with 2 different channels. You're gonna put the channel in on one of the sides. And then it comes with a 9-volt battery that you're going to put in.
Yeah. No.
So we're gonna have 4 electrodes. We're gonna be doing her shoulder today. So, before you wanna put the electrodes on, you are going to take either an alcohol pad, just in case they have any lotion, and you're gonna clean that area. So we're gonna be doing her left shoulder. Area. And then you're going to take a damp towel and then wipe off that alcohol.
Yeah, we should have a meeting soon.
So we'll be using the Intellect TENS unit. So what we're gonna do is, this is for pain reduction, right? So there's 3 different modes that we can do. We're gonna go on normal first. And the first one is going to be, we're gonna set up the parameters for conventional TENS. So conventional TENS works by using the gate control theory. So what it does is it blocks the pain receptors that from reaching the brain, and it interrupts that pain signal. And with this one, we're going to go to mode. So we're gonna find the rate. So the rate is the frequency, and this one is going to be between 30 and 50. There we go. So for right now, we're gonna try 50 with this, and then we're gonna set, oh God. Okay, that's set. Now we're gonna go, the width is also known as the pulse duration. So this one we want between 50 and 100. So we're gonna bring this down. Let's go 100. And then the intensity, so she's going to feel a tingling sensation, and there is no ramp time, no on and off time, no vector scan or sweep. So the treatment, they can keep this on for the 24 hours, but they want to have them a break in between, because they don't want that constant feeling of that euphoria effect. So, but the downside is it only works if the machine is on. So once they take the machine off, they won't be feeling that pain relief will not go away. So, and we do want to be functional with this. So when I put this on, I'm gonna have her do some bicep curls while she's doing this. And then for the duration, it's going to be about 20 to 25 minutes. Okay, there we go. So now for the electrode placement with the TENS, we are just gonna go parallel. So if we have 2 channels that I'm going to hook up. We have 1 red and black channel. And then you're gonna connect it to the pads. I'm gonna put this one on first. Okay, so her pain is here, kind of in that, where that bicep is. So we're gonna go 1 here, and then it's gonna run parallel, right? So we're gonna go, this channel is gonna jump from here to here. And then this is the second channel, which is also red and black. So with the conventional TENS, like I said earlier, the patient will feel more comfortable with this one. It's just gonna be a mild tingling sensation that they're going to feel. And we're not going to see a muscle contraction with this one. So I had already set up my parameters. So I had my duration at 100, and then my frequency is at 50. And then I'm gonna bring my timer to, we're gonna do at least 20 minutes, but for the purpose of this video, we're just gonna do a couple and see how she feels. Okay. And then this is the top where you're gonna control the intensity. I'm slowly gonna raise up the intensity and then continually ask her how she's feeling and if it's comfortable. Ready to get started? Let me know once you start feeling that sensation. Okay.
I feel a little bit of tingling.
A little tingling.
Is that comfortable?
Is that comfortable? Okay. So she's at about between 4 and 5. So then okay, feels good. Strong. Yeah.
Yeah, it feels
Okay,
good.
good. So right now I'm gonna have you do a couple bicep curls. Let's do about 10 while we're doing this. Do you feel a difference as you're doing some movement with that?
Yes, me. Which one did you guys do?
So we're placing the electrodes at the motor points. That's the area where the motor end plate enters the muscle, and it's usually located at the middle of the muscle belly. So we have a pretty big vascular area here. So she'll be feeling the sensation more.
Yeah, me? Yeah.
Who's your partner?
15.
Okay, you can relax. Okay, so that is the first mode. That is called our conventional. So now I'm gonna turn this on. And I'm gonna leave the same ones here. So now we're going to, I'm gonna set up the parameters for acupuncture TENS. Acupuncture TENS works at a lower frequency, and with this one we're gonna see a visible muscle twitch. It might be a little bit less comfortable for the patient because what we're doing, it's the endogenous opiate theory. So this type of electrical stimulation will last longer. So when we take off the machine, she'll still feel that opiate release. So what we're gonna do, I'm gonna turn the machine on. It's still gonna be at the mode normal, but I'm just gonna change my parameters. Okay, so my rate for this one, we are going to be between 2 to 5. So I'm gonna drop it down. I'm gonna meet in the middle. We're gonna go to 3 for my frequency. And then my pulse duration, also known as the width, is going to be 100 and 300. So I'm gonna keep it at 100. And then my time is gonna be between 20 to 30 minutes as well. Okay, and you ready to get started? Okay. Bored already? And with this one, we also wanna do functional movements. So once I see that visible muscle twitch, I'm gonna have her do some bicep curls as well. Please tell me I'm recording. Okay. Okay, and this one does not have any vector scan or any on-off times as well. Okay, so I'm just gonna be watching for that muscle twitch. Ooh, there it is, there it is.
I feel it.
Where did it go? So it's a lot different. So now we're gonna just do some bicep curls over here. It's a little bit less uncomfortable for the patient because you are visibly having that muscle contraction. So this is option B for the 10s and 10. Good. And then I'm gonna turn on the machine, and that is for the acupuncture. How did that one feel?
Not that great.
Not that great.
Not that fun.
So for the next one, this is called the burst mode. So with this one, we're also going to be using the same intellect machine. And so the goal is again to decrease pain as well. But with the burst, it jumps in between that conventional mode and the acupuncture mode. So she's gonna have periods where you're just gonna feel that tingling sensation, but then she's also gonna have periods where it's going to be that visible muscle twitch. So it jumps between back and forth with this one. So on this intellect mode, the frequency is already fixed at 100 megahertz. So I'm gonna turn this back on. So we're gonna go from normal to mode. I'm gonna go to burst. So since my frequency is already set, you can only change the width. So the width is going to be, or the duration, between 150 to 500. So let's meet in the middle. Let's try 200. Okay. And then, so like I said, for the intensity, she's gonna feel that tingling, periods of tingling, and then periods of the muscle twitch. There's no RAM time, no vector for this one. And the treatment time is about 15 minutes or whatever the patient can tolerate. Okay, you ready?
Be ready.
So we're already seeing that muscle twitch here. Is it painful?
No, it's not painful.
Not
I just feel the.
What is, do you feel more of like a, kind of a,
It's like a.
almost like a tap? Like a
Yeah.
tap?
A tap with like someone with like long nails and just like grabbing like some like
Gotcha.
pinch your skin.
So that burst is kind of gonna go from a wide area to kind of the more center with the visible muscle twitch. This is the third option for the TENS unit. They all help with pain reduction. So whenever we're explaining this to the patient, we want to go through all three modes to see what feels comfortable and then make sure they know what parameters to set for when they do take this unit home. So which one did you like?
Or the conventional.
The conventional? Perfect. Okay, so since you like the conventional, it's a lot more comfortable. You can use that mode while the patient is walking or kind of doing things around the house, which is nice because they can have it on for up to 24 hours. However, you just want to take at least a 2-hour break in between because, like I said, you don't want that continuous feel of euphoria. So you want to know like what pain actually feels like. Okay. That's 10 units.